Hello everyone, my name is Irini Agathagalo and I am a therapist at Stabilis Treatment Centre. Stabilis Treatment Centre is a professional rehabilitation centre providing professional treatments for drug, alcohol and medication dependency. But today I want to talk to you about a hidden gem that Stabilis has to offer its community, and this is called the Prevention for Teens program. Here at Stabilis Treatment Centre, we do not only offer a full-time inpatient program, but we also offer the opportunity for people to come in as outpatients in order to address their addictions or to stop possible addiction from developing. The Prevention for Teens program is an outpatient program developed for teens who are facing the social temptation of drugs and alcohol abuse. This program has been developed specifically for teenagers between the ages of 13 to 18 years old. Adolescents or teenagers are marked by major physical, emotional, and behavioral changes as they develop. This is because they're starting to adapt to a life of adulthood. Unfortunately, it is during this developmental stage that we might notice some rebellious behavior. And yes, this may include experimenting with drugs and alcohol. And no, this is not beneficial for this particular developmental stage. But don't be alarmed. There are some indicators that may show you as schools or parents that these particular teenagers are experimenting with drugs and alcohol. It is important to keep an eye out for these indicators, and I'm going to discuss a few with you. As I mentioned before, it is extremely important for schools and for parents to familiarize themselves with these indicators of substance abuse that we are going to discuss. I'm going to break these indicators up into three categories. It will be physical, behavioral, and psychological indicators. It is also very important to note that if you do notice these indicators, it does not guarantee that the teenager is abusing substances. It just maybe opens up the door for you to open communication with them and ask them if everything is okay. If you are still unsure, there's always the possibility for you to come into Stabilis and have a random drug test done on the teenager. This will give you a definite answer. Okay, starting off with the physical indicators. Okay, so the first one is that you may notice the adolescent's eyes may be what we call bloodshot. This is when the eyes may appear quite swollen or irritated, quite red. You may also notice a decrease in appetite or an increase in appetite, where they're eating a lot more or they may be eating a lot less. What may follow after this is that there may be a sudden increase in weight gain or a significant decrease in weight loss within a short period of time. I would also like you to listen out when they speak. Are they speaking quite rapidly? Is the speech a lot faster than normal? Or it could even be a lot slower than normal. When they speak, they might even have slurred speech. Okay, so that all falls into the physical indications. The behavioral indications, things that you may observe is their school attendance may be dropping quite dramatically, where they're not attending school anymore. They might not be attending extramural activities. What may follow that is a significant decrease in grades, their grades for their academics, where they may be doing, in the past, they may be doing very well at school, but all of a sudden they're not doing so well. A very important one that I really want you to keep an eye out on is isolation, where they start isolating themselves, they start being alone, they might isolate from the family or in some cases even friends. And also look at the level of conflict within the family. Now, conflict with a teenager in the house will always be present, but when conflict severely starts to increase, that there should be a question mark there as well. With the psychological indicators, you must notice if there's been a sudden severe shift in the personality, if there's been increase in stress or anxiety, sudden mood swings, if there's been drastic mood swings. And a very big one for me that I really want you to pay attention to is if there are any signs of depression. If you have noticed any of these indicators, as I mentioned, I think this will be the perfect opportunity to open up the doors of communication, ask them if they're okay, if you could possibly help them. And yes, if there are any of these indicators, this may mean that the adolescent is a candidate for the Prevention for Teens program, and they're more than welcome to start joining the program. If you are interested in enrolling a teenager for the program, you would first need to phone Stabilis and make an appointment with a therapist so that an evaluation can take place. This is to see if the teenager is a candidate for the program. If the teenager is indeed a candidate, they can start immediately with the program. They will need to complete 5 workshops, which will be over a period of 5 weeks, as we only present 1 workshop every Thursday. During the duration of the 5 weeks, there will be 2 random drug tests that will be conducted on every participant, as the Prevention for Teens program has a zero tolerance policy when it comes to drugs and alcohol. Once the participant or the teenager has completed the program, all 5 weeks, we will provide them with a feedback report that they can give to their parents or to their school, stating that they have completed all 5 workshops and they have completed the whole Prevention for Teens program. The 5 workshops provided by the Prevention for Teens program intend to provide its participants with enough psychoeducation about the dangers of substance use, substance abuse, and how this may develop into full-blown addiction. We encourage all the participants to try and engage and ask questions during the workshops. We do this by creating a safe, non-judgmental, and friendly environment, which allows the participants to feel free to understand and learn every topic of discussion. The Prevention for Teens program welcomes any and all adolescents that show interest in the program. Stabilis Treatment Center is here to help you and your family. If you would like more information about the Prevention for Teens program, or any program that Stabilis has to offer you and your family, such as the Survivors program, or our all-inclusive inpatient program, please feel free to contact us. Well, that's all from me. Thank you so much for taking the time to watch this video. Please go like our social media pages on Instagram, Facebook, and on YouTube. Thank you.